Hello all, this is Dr. Alsup, and in this video we will be discussing the lumbar plexus. And I know the term plexus may raise some of our blood pressure a little, but we will focus on the basics here, with an emphasis on where we can locate these named branches, particularly when we're talking about within the abdomen. And then we will focus in a bit more on 3 specific branches, as the others will be discussed in more detail during the musculoskeletal content. So let's start with what makes up the lumbar plexus. But before I get into that, I want you to think back to other plexuses we have discussed. What were they composed of? So recall that the majority of the nervous plexuses that we have discussed so far have been composed of almost exclusively autonomic fibers. The lumbar plexus and the sacral plexus, which we'll talk about in upcoming videos, are unique in terms of what we've discussed so far. They're not necessarily unique in terms of the overall scheme of the nervous system. But these are different in the fact that they are predominantly somatic nervous plexuses. So this means that the majority of the fibers that are going to make up the lumbar plexus are either somatic afferent or efferent fibers. So they're innervating skeletal muscle, they're innervating skin, and other more somatic structures. These somatic fibers are derived from the ventral primary rami, or the VPRs, of spinal nerves L1 through L4, thus the name lumbar plexus. So that L, recall, means lumbar. So those fibers from the VPRs of L1 through L4 will braid, they'll network, and then they'll coalesce into named branches which may have fibers from multiple spinal cord levels. So those branches that we'll talk about, many of them are, say, from L2 and L3 or from L1 and L2, so they have fibers from multiple spinal cord levels. Now, when we're trying to identify those named branches, the psoas major muscle, which I am outlining right here, is going to be a major player, an important landmark in terms of identifying these. Psoas major will actually share a common tendon with the iliacus muscle right here, and they will attach to the proximal femur. And so these muscles are often referred to together as the iliopsoas muscle, and that's going to be an important and powerful flexor of the hip joint. But for today, we're going to focus on the psoas major muscle and its role as an important landmark for differentiating the branches of the lumbar plexus in the abdomen. There are 6 main branches of the lumbar plexus, so starting superiorly and making our way inferiorly, so these will be the most superior of those branches, and these would be the most inferior. The first 2 you're going to have are the iliohypogastric and the ilioinguinal. And you can actually see on this particular individual that these nerves are coming off of a common trunk, as these are actually both derived from L1. And we'll talk about that in a bit more detail in a moment. But if you don't have them coming off the common trunk, generally you'll have the iliohypogastric being the more superior one, with ilioinguinal a little bit more inferiorly placed. I hope you recall that the ilioinguinal nerve is going to traverse the inguinal canal, and so we'll come back to that in a moment as well. Next, you'll have the genitofemoral nerve, which I think is the easiest to identify within the lumbar plexus, as this particular nerve will actually pierce through the belly of the genitofemoral, or of the psoas major muscle. And you can see it piercing through and then kind of running along the superficial border of the psoas major. So that's something you'll see quite often, which muscle is going to pierce the psoas major muscle, and the answer is genitofemoral. At around mid-belly of the psoas major, the lateral femoral cutaneous nerve is going to be located kind of moving laterally. I always think of it as heading towards the anterior superior iliac spine, which would be just around this general area, maybe a little bit higher up there, and it's kind of crossing over the iliacus muscle, as you can see here. The last 2 nerves are also the largest branches of the lumbar plexus, and these are the obturator nerve, which isn't as easily identifiable on this particular image, but it is going to be kind of deep to the artery and vein right here, and it will be more inferomedial, so it'd be kind of right around this region here. Whereas the femoral nerve, which is the largest branch of the lumbar plexus, is going to be located on the inferolateral border. And you can see that one here. You don't have any arteries or veins blocking its view. So both of these nerves, both the obturator and the femoral nerve, are hugely important in terms of musculoskeletal anatomy, in terms of innervating large portions of the thigh musculature and skin. So we'll definitely kind of put a pin on those, and we'll come back to those in more detail later. So let's spend the last few minutes of our time here focusing a bit more on the functions of these more superior branches of the lumbar plexus, as they have bigger roles either in the abdomen or the pelvis or both. So the iliohypogastric nerve, which you can see here, is going to be composed of fibers of L1 and only fibers of L1. So not one of those typical plexus nerves, which will have fiber contributions from multiple levels. This is also true of the ilioinguinal nerve. So both are derived from just fibers from L1. And this is why we often see these nerves coming off of a common trunk before branching and heading to their target organs. Both iliohypogastric and ilioinguinal nerves will afferently serve portions of the anterolateral abdominal wall. So you can see that here and here. So they're sending signals back to the central nervous system regarding what is happening to the skin in that region, or in terms of proprioception of those muscles there. Additionally, they will both provide efferent innervation to those same muscles. In addition, the ilioinguinal nerve will provide afferent innervation to the superior medial thigh, as well as the anterior perineum and portions of the external genitalia. So skin over the mons pubis and the labium majus, or the root of the penis and upper part of the scrotum. Recall when we're talking about the ilioinguinal nerve that it's going to traverse the inguinal canal superficial to the round ligament or the spermatic cord, and it will actually exit the superficial inguinal ring, so dividing into those terminal sensory branches. That'll be important in terms of providing afferent innervation to this region. Lastly, let's talk a few more specifics regarding the genitofemoral nerve. This is more like a typical plexus branch with fibers from multiple spinal cord levels. So we're talking L1 and L2. As its name would suggest, there are actually two major branches of the genitofemoral nerve. There's going to be a genital branch as well as a femoral branch. And the genital branch, in terms of afferent innervation, is going to overlap considerably in terms of area that it will innervate with the ilioinguinal nerve. So you can see here mons pubis, labium majus, and scrotum. That's very similar to what you have in terms of the ilioinguinal nerve. So considerable overlap in that region. The femoral branch of the genitofemoral is closely related as well, but it's going to be a bit more in terms of the anterior medial thigh, whereas ilioinguinal is going to be a bit more superior. In terms of efferent innervation, its genital branch is going to innervate the cremaster muscle. We haven't actually talked much about the cremaster muscle yet, but it's located as a very thin layer of muscle in the inguinal canal and continues surrounding the spermatic cord or round ligament of the uterus, even past the superficial inguinal ring. It functions to pull the round ligament or spermatic cord kind of towards the superficial inguinal ring when it contracts, with its most noticeable function of kind of pulling the testis towards the ring as well. So that's often when you see the function or the action, that's often what you will see. All right, excellent. Here is your summary slide. Again, focus on how you will locate these branches when you're looking at the lumbar plexus in the abdomen, with that special consideration of the psoas major muscle, and get down into the additional details of just these three nerves here in terms of the lumbar plexus, because the other three nerves we will discuss in more detail later on in the curriculum. Thank you for your time and attention here, and have a great rest of your day.